Hey everybody, welcome back. We are now week 11 pre-recorded lecture for Tai Chi and Qigong at ACCHS here in the spring semester of 2021. When we were last together last week, we talked about the principle of the 6 harmonies, which is a way of organizing our bodies and our minds so that everything moves together. And so just to quickly review, we talked about the internal harmonies, which were much more about how we orient ourselves in relation to our emotional body, our intentional body, and then sort of our full body awareness, our chi. So we call that unification of heart and intention, unification of intent and chi, and then actually applying that towards accomplishing something in the world, which is unification of chi and force. And these are known as the internal harmonies because they deal with much more affairs of sort of the spirit or the intangibles, right? If we want to talk about the external harmonies, just to review, we're talking about anatomical structures that are meant to move together. And this is highlighted in the internal martial art of Xingyi Quan, but holds also true for TaiJi Quan and also for Qigong. And if you are working with your body in any situation where you want to apply force, moving the hip and the shoulder, moving the elbow and the knee, and also moving the hand and the foot together, it's considered an efficient way of organizing your body in space so that you can move from your internal harmonies to an expression of that in the outside world, the external world, right? So along those lines, we want to dig in a little bit deeper into both the physical anatomy and the energetic anatomy of particularly how we connect this all together. And so we're going to talk a little bit more in depth today about a conversation we started about the shoulder and the hip, regarding the shoulder area and the hip region, and work on a little bit of vocabulary and then circle around to how this applies to energetic flow within the human body itself. So when we're doing a Qigong practice or an internal martial arts practice, we often speak of the cavities of the body. And these are spaces within the body that we can deliberately feel and activate. Particularly the big ones that we're talking about today are the hip and shoulders nest. So to review, to tie this all together, we discussed in the first couple of weeks of class that the view of the cosmology of East Asia is that the universe is a phenomenon of breath. And by breath, we mean the sort of living, pulsing energy that has a rhythm. And the reason that our philosophy has called it a phenomenon of breath is because of this rhythm, because of this opening and closing, which we talked about as expansion and collecting, kai he, right? So expanding, open, and then collecting, close. And we see this energetically in macrocosmic rhythms, such as the cycle of the day where the light expands and then contracts. Our activity levels of the natural world expand and contract. We see it in the cycles of the year as the natural world expands as it is right now as we approach the equinox, and then starts to contract. When we get to the fall equinox, we really see that activity starts to really cool off and go down, right? So we could call this as a reflection of the principle common in both Eastern and Western traditions of the microcosm reflecting the macrocosm. So just as the natural world outside of our bodies expands and contracts, inside our body, we experience this directly too, as our bodies are expressions of rhythm. The one nearest to us would probably be the breath, the actual physical breath, that we expand our lungs and then our lungs exhale. So this thing that we do like experts, we started out however many years ago with our first breath outside of our mother's body. And once this rhythm stops, we say that that's our allotted time is over, right? Our allotted time is over. So inside our bodies, we have these rhythms, and we have other ones too. So the pulsing of the heart, right? That would be a big one. The movement of the digestive system is also a rhythm that we have. There's many rhythms that we have that express this connection, this harmony, this ganying, this reciprocity of our own experience with that of the natural world, that we are not separate from it, but that we participate in the same energies that happen at different scale. So one other way of expressing this principle is the Dao De principle. So Dao being the big picture, the sort of universal picture of everything that's happening in the universe, and De being our individual experience of this. So our individual experience harmonizes with the universal experience. In fact, most of our medicine is focused around the vicissitudes of this harmonization. How do we, for ourselves and for our patients, best ride the dominant currents of energy that are happening around us, right? And sometimes that's through lifestyle modifications, sleeping on time, eating on time, that sort of stuff, breathing well, this sort of thing. Sometimes we need expert intervention to kind of bring us back into harmony, and in which case we might use medicinal herbs or an acupuncture treatment to break up the stagnation, get things moving, right? Going from big abstract principles back to sort of a very particular learning goal that we have today. Today we're going to explore the axial versus the appendicular skeleton to show how we can put this expansion and contraction into our physical movements, right? Into our physical movements. So obviously there's certain ways that are very easy to do, like breathing. We talked about that. That's a physical movement, primarily the diaphragm, but all these other ancillary muscles that help us breathe. Or we can open and close our hand, and that's a kai-ha, that's an opening and a closing. But we're going to talk about something a little bit closer to actually activating stronger energetic awareness in our bodies and stronger integration of our bodies as discrete entities that move in space. We'll say that. So the first vocabulary that I want to familiarize yourself or reacquaint you with, if you haven't studied anatomy recently, is this idea of axial versus appendicular skeleton. So when we talk about anatomy, we can talk very broadly about two big parts of our skeletal system, one being the axial, and the axis being the spine and the skull, going all the way down to the tip of our tailbone through the sacrum. So this is all considered the axis of our movement. So if we're talking energetically, this axial skeleton, we would talk as sort of the central channel. And the central channel is not a channel that you can actually hit with an acupuncture needle because it's deep in the body. We would locate it, I guess DU20 would be the top of the central channel, and REN1 between the genitals and the anus would be the bottom of this of this sort of axis, this central channel. But those are really the only access points in the body where we can directly needle it. And half of these being REN1, we don't commonly needle in clinic, although DU20 we needle every day. When we talk about our Qigong practice, where we're talking about moving our feeling awareness through the body, being in touch with the central channel is really one of the main goals, being aware of our center. And last time we were together, we did an exercise where we kind of moved the hips and the shoulders together. And what that actually does is it gets us to move our whole spine together, right? And if we can move our spine in an integrated fashion, then we can start to access this idea of the central channel moving as a unit, right? And just as an aside, I will say that the actual physical spine is not regarded as the central channel because it's an awareness thing, it's a chi thing, so we can't dissect it out of somebody. And in terms of your own feeling awareness, typically the central channel is actually directly in front of the spine, sort of this core energy of our body, right? It's not the bony structure, it's the awareness. And typically a really awake central channel will be directly in the core of our body. So we can get into more details about that later. The axial skeleton is arms and legs. It's how the appendicular skeleton, rather, excuse me, here pictured in blue, is our arms and legs. It's our limbs, right? And often we make the mistake of thinking that our limbs start with the humerus and the femur. So the humerus and the femur are these big bones that we see here, the upper arm bones and the thigh bones, right? That plug in with these ball and socket joints into what we think of as a torso. But anatomically, it makes more sense for us to remember that the appendicular skeleton actually begins with the shoulder blades and the clavicle and the upper body and the pelvic girdle in the lower body. So this complex of bones that attaches to the sacrum, right? Which then attaches to the big bones of the femur, or in the upper body, the big bones of the humerus. So we don't want to fall into the trap of thinking that our shoulder starts out here at the humerus. Our shoulder actually starts with everything that's not rib cage and neck, right? And our legs, our appendicular skeleton in the lower body doesn't start with the big bones of the thighs, the femurs, but it actually starts with the pelvic girdle. And there's motion in the pelvic girdle, as every chiropractor will tell you, that this movement of ability of the pelvic girdle to move and flex is part of our movement pattern as a human being, and it can get stuck, right? So in principle, we just want to be very clear about what's axial and what's appendicular. And this will actually, from an anatomical point of view, gives us good clarity about what we're trying to access when we start to talk about the connection between our central channel and our left and right channels, which we'll get to in a little bit. So let's look just briefly into sort of the anatomy of these areas. We can talk about the shoulder's nest, or the axillary cavity. If this is a new word for you, the axilla refers to the armpit, right? The shoulder's nest is this whole region. It's what ties together this appendicular skeleton onto your axial skeleton. So we just said that it is not the arm, it's actually the shoulder's nest, which includes our clavicle and our scapula and the fascinating bone of the scapula. This anatomy, you will need to learn it up and down now or later. So I recommend you start learning it now if you're unfamiliar with it. And I like this picture on the left-hand side here, where we have the skeleton picture and there's a sort of grayed out, there's this grayed out region of this triangle. And energetically, in my personal experience, it's not as much of a triangle as it is sort of a ball that we can open and close. And even in this flapping motion, that's what we're doing right now. We're expanding and collecting this region that's tucked underneath the clavicle, in front, anterior to the scapula, and lateral to the rib cage, although the opening and closing of the rib cage will also, the spreading and contracting of the ribs will also influence this area, right? So we can call this the shoulder's nest. We can call it the axillary cavity. You can also call it the pectoral girdle. And we don't want to overemphasize the pectoral muscles, which are these big muscles in the front. We have the major and the minor, right? But we will look at them briefly here on the right-hand side. We have sort of the meaty picture here that puts all the various muscular and circulatory structures, and you can even see some of the nerves here into this region. So they've resected off the actual pec major here because you can't see it. You can see that green arrow, which points to some of the arteries and veins that go in through there, is also pointing to where the pec muscle has been resected and taken out of the way. All this action happens behind the pectoral muscle, right? It happens behind the pectoral muscle in that hole in your body that the armpit inhabits. So this is an actual space in our body. You couldn't, it's not like a kangaroo's pouch. You couldn't store something in it per se, but energetically and sensorially, it is actually a space in your body. It tends to get a little bit short and contracted in our modern skeletal holding habits, right? But I want everyone to start familiarizing yourself with this area. It's an area that experiences a lot of dysfunction. So we see a lot of patients that have issues in this area. It's an area where we needle this area almost every day in our clinic for various different reasons. But it's also an area where there's some major blood vessels and some major nerve bodies. And obviously we never want to needle a blood vessel unless we're a phlebotomist, right? Nerves, well, there's certain reasons why you might want to needle a nerve, but typically you're not going to encounter those for a while. It's really for stroke rehabilitation and things like that you might be using some of these. Shinyan Kaichao is the name of the school that actually needles these nerves directly to help people recover from various neuropathic issues such as stroke recovery, things like that. So we want to familiarize ourselves with the anatomy of this area, have a conceptual model of it, but then really when we get to our Qigong practice, we're looking for the direct experience of what does it feel like when we access this area, what exercises can we do to help open up the awareness in this area. But for right now, vocabulary, shoulders, nest, axillary cavity, pectoral girdle, we're all talking about the same thing. What ties your arm to your torso, right? What ties your arm to your torso? In the lower body, we'll talk about the hips nest. And we talked about this a little bit last time we were together. We got into a little bit of a digression about the psoas muscle. But the pelvic girdle also fascinating for us. We can call it the hips nest, the pelvic girdle, the hip girdle. It's the encircling bony structure. The girdle itself is the bony structure supporting the lower limbs. And in this diagram, we can see that there's the spine descends down into the sacrum and the tailbone, and everything that's not that is going to be considered the hip girdle. So it's these big pubic bones that kind of wrap around from the back to the front and join at the pubic symphysis in the front, this area of soft tissue that actually softens and separates when women give birth. It's an area of very complex musculature. It includes a diaphragm. There's a pelvic diaphragm. It includes the pelvic floor as well, which is an issue that a lot of people have some problems with, especially as they age. And we can see our psoas muscle here on the left-hand side is this muscle that's the topmost muscle that ties the anterior surface of the lumbar vertebra all the way through to the actual big bones of the femur. So fascinating area for anatomy. We can needle a lot of these muscles to great effect. The posterior view is as fascinating as the anterior view, although we've got the anterior view here. Those big glute muscles in the back, big chunky muscles that help propel us through space, super strong, and also areas where a lot of people have chronic issues. So the vocabulary word that I want to review today is this qua, or inguinal fold and surrounding areas. So On the left-hand side, you can actually see, sorry, the right-hand side, you can actually see on either side of the pubic symphysis, this cartilaginous piece at the bottom that ties the two parts of the pelvic together, there's this inguinal ligament, which stretches from the bones in the front of the pelvis over to the bony protuberances on our hip crest. And this inguinal ligament shows us where the inguinal fold is. It's where your body folds when you sit down, right? It's where your body folds when you sit down. So this area we can call the qua, or sometimes the yao qua. And it's a very important area for us energetically when we do our practice. And we'll be working on an exercise when we get together about actually moving this area specifically and trying to activate it a little bit. So remember, your leg starts at your hip, not at your femur, right? This is important. And your shoulder starts at your clavicle, not actually your shoulder, you could even say starts right here at the sternoclavicular joint where your clavicle comes in and joins it. This is way closer to the center than most people think about their shoulder, but if you lift your shoulder, you can feel that clavicular head moving around, and people have issues with this. And this is an arm movement, right? This is I'm moving my arm, I'm moving my shoulder, but this area right here is activated. So it brings our center in a little bit more towards center and gives a little bit more emphasis on how these areas of the axial skeleton are tied into the appendicular skeleton, right? So let's shift our gaze just briefly to energetic anatomy. These are really, really important areas. These regions are the thoroughfares of blood and energy from the core to the extremities. So in our Qigong practice, we say when we activate the awareness of these areas, we start to open up the left and the right channels. We can't stick a needle in the left and right channels. These are channels that you experience directly as they open up. As you get your torso to communicate with your limbs, you will have a better experience of sort of these thoroughfares of awareness through your body that connect the core, the central channel, to the left and right channel. And in the torso, we actually have a central channel that goes down the middle, and then we have left and right channels that kind of go on the sides of this. Over time, if we practice our liu he, our 6 harmonies, and move our hips and shoulders together, our elbows and knees together, our wrists and our ankles together, then we get more clarity about left and right channel connections. And it's way easier to move from the left and right channels and the central channel in an integrated way than to try to get all these random bones, ligaments, and muscles to move together in a coordinated fashion. So we do exercises to cultivate a sense of whole body awareness, or awareness of left, right, and center, right? If we have tightness in this area, it will restrict free flow. And we know that the root of disease, of many diseases in Chinese medicine, is this restriction in free flow, right? It's more common for us in our sort of sedentary driving, computing culture to have restriction in tightness in the front areas of the body. So short pecs is very common. And we can even think about, this area of the top as being restricted as well. This is supposed to be a yin surface. It's supposed to be soft and receptive and open. And there tends to be an aggregation of tightness in this area. And the same is true down in the hips. And once we have disorder on one side, we're gonna have disorder on the other side, right? So if we cultivate the awareness of this space, it allows things to flow out from the core to the extremities much more easily. And we can avoid some of the pathologies that might emerge. So if we do have pathological tightness in these areas, or even just lack of awareness of these areas, we can end up with shoulder and neck pain, which is probably the top coded thing that people see acupuncturists for, is shoulder and neck pain. We can also have hip and lower back pain. And because tightness in this area can restrict blood flow, there's these huge blood supplying vessels that move from the core out to the extremities. We can end up with cold hands and feet because the blood flow is actually restricted here too. And at its extreme phase, we can have things like thoracic outlet syndrome, probably overdiagnosed, but it does occur where these the anatomy of the shoulder girdle is restricted to the point where muscles and bones combined are actually putting pressure onto the nerves and the arteries that supply blood and awareness out to the limbs. And we can end up with, tingling and numbness and chronic pain and lack of coordination and coldness, all these kind of things that can happen. And we can see it, this happens in degrees. So sometimes we see a little bit of this, sometimes we see a lot of this. But our goal in our practices is to open up the awareness in these areas so that we don't have as much of that. So when we meet together on Thursday, we're going to work on some exercises to pulse the cavities of the body. And this may sound esoteric at first, but there's some simple movements we can do. We're going to work on moving the shoulders, nice and easy pulsation. We're going to work on pulsing the qua with what's called a qua squat, where we try to activate the inguinal fold pretty directly with a very specific exercise to activate the deep muscles of the psoas without cheating. And we will work towards building this awareness of the left and right and awareness of the appendicular versus the axial skeleton so that we can have a more complete integrated experience in movement and awareness as we try to deepen our Qigong TaiJi practices and ultimately your needling practice as well. So if you have a loose, relaxed arm and you're needling somebody, it's going to be way better than if you're all bunched up here and trying to jab somebody with something that doesn't have that much blood and qi, right? So I would also recommend, check out some disciplines where you need to have openness and free flow to your hands. So watching master calligraphers of the Chinese or the Japanese tradition, the way they hold their brush and the way that they orient their body and the way they keep their spine erect shows you that it's not like my second grader when he's coloring a picture where he's kind of hunched over with his teeth gritted and he's like scrubbing with a crayon. There's a sense of whole body engagement to the movement of the hand. And I think there's lessons that we can take in our own needling practice that will help inform that. Traditionally, people that practice TaiJi would also practice calligraphy to give them soft, awake, alive hands that are connected to their center, because the expression of the character is meant to come all the way from the center of the being, not just from these small movements of these small muscles of the hand, right? So Chen Manqing, probably the most famous TaiJi practitioner of the modern era in the West, is famous because he had one of the softest expressions in his TaiJi form. People sometimes say he has dead fish hands, but he has a very soft hand, but he was also a master calligrapher. So he had acute awareness. He had this intense awareness through the softness of his hands and the openness of his central channel to be expressed through this softness in his upper body that led to extraordinary power and also extraordinary sensitivity. And as acupuncturists, we're definitely looking to cultivate sensitivity more than power, but we need some little bit of power too. So when we meet together on Thursday, we will review this briefly and then do some exercises together to try to open up these areas a little bit. And I'll send out maybe a link to something that talks a little bit more about this this Yao Qua, this inguinal area, so we can look at that together. Okay, so that's it for now. I'll see everybody on Thursday.